Welcome to our comprehensive discussion on the various aspects of cancer. Our aim today is to delve into its causes, treatment, and the future of cancer care. Let's start with introductions. I'm Dr. Laura Hawley, your moderator for today's roundtable.
I'm Dr. Tasha Washington, an oncologist. I'm looking forward to sharing insights on diagnostics, treatments, and new research developments in cancer care.
Dr. Arthur Hastings here. As a surgical oncologist, I'm eager to discuss the evolution of surgical techniques and their critical role in cancer treatment.
I'm Dr. Michael Tang, specializing in infectious disease. The intersection of infections and cancer development is a vital conversation, and I'm here to contribute to that.
Dr. Ted Bates, a neurologist. Understanding the neurological implications of cancer and its treatment is my focus, and I anticipate enlightening discussions today.
And I'm Dr. William Clark, an endocrinologist. I'm particularly interested in discussing the hormonal and metabolic changes related to cancer risk and progression.
Excellent, let's dive right in. Understanding cancer's complexities requires a multidisciplinary approach. Tasha, could you start us off by discussing the role of genetics in cancer development?
Absolutely, Laura. Genetics play a crucial role, but it's a double-edged sword. Hereditary cancer syndromes are a testament to our need for genetic screening. Early identification can significantly alter treatment pathways.
And from a surgical perspective, genetic insights have transformed how we approach cancer treatment. Tailoring surgical interventions based on genetic markers has been revolutionary.
On the note of genetics, let's not forget the role of viral genetics. Certain viruses are known to cause cancer, pushing the envelope on how we think about prevention.
It's fascinating, Mike. The neurological responses to these viral infections and stress, in general, can also impact cancer progression. Our body's response is as critical as the genetic predisposition.
All solid points. However, I'd like to underscore the metabolic and hormonal underpinnings. Our understanding of genetics should extend to how chronic conditions predispose individuals to cancer. It's a holistic view that's necessary.
Indeed, William. And with chronic conditions comes the discussion on inflammation's role. But let's save that for our next segment. As we move forward, remember, our objective is to uncover and debate these interconnected factors shaping cancer care today and tomorrow. With such diverse expertise, I'm confident our discussions will be nothing short of enlightening. Let's proceed. Welcome. We're diving into the critical discussion on the role of genetics in cancer development. Dr. Tasha Washington, can you start us off with your insights on hereditary cancer syndromes?
Thank you, Laura. Absolutely. The landscape of genetic screening has dramatically changed our understanding of cancer. We now know that mutations in genes like BRCA1 and BRCA2 can significantly increase the risk for breast and ovarian cancers. Identifying individuals with these mutations before cancer develops can lead to life-saving interventions. If I may jump in, Dr. Washington, your point about genetic screening is pivotal, but we also need to include viral genetics in this discussion. The relationship between certain viruses and cancer development, such as HPV and its link to cervical cancer, underscores the genetic complexity of cancer beyond heredity. Mike, that's a well-made point. The viral genetics component plays a crucial role, bridging the gap between infectious diseases and cancer, broadening our scope of prevention and targeted treatment.
Dr. Laura Hawley here, touching on that, understanding the genetic predispositions can not only help us in preventing cancer, but in ensuring heart health among cancer survivors. It's a dual-front battle where cardiotoxicity from cancer treatments must be managed with a genetics-informed approach.
And let's not forget, while genetics provide us a map, lifestyle and environmental factors are just as crucial. A person's genetic makeup may predispose them to cancer, but lifestyle choices can dramatically influence that predisposition.
I'm glad you brought that up, William. However, there's a fine line between acknowledging the impact of lifestyle and promoting a narrative that blames individuals for their illness. The genetic component is something they cannot control, after all.
Exactly, Tasha. It's about finding the balance in discussion. While we emphasize genetics and its undeniable role,
the environmental and lifestyle factors should never be used to stigmatize or blame patients. It's about informed prevention and treatment strategies.
And speaking of prevention, the role of immunology in this genetic-environmental nexus is fascinating and promising. By understanding genetic risk factors alongside environmental ones, we can potentially develop better vaccines for virus-induced cancers. That's a compelling direction, Mike. It's this multidisciplinary approach that will eventually usher us into a new era of cancer treatment and prevention, where genetics, immunology, and lifestyle factors are considered together.
I appreciate this robust discussion. It's clear that the role of genetics in cancer is a tapestry of complexity, involving heredity, environmental factors, and beyond. This holistic view is what will ultimately lead us to more personalized and effective cancer care. Thank you all for your insightful contributions. Let's continue to challenge and learn from each other as we move on. Let's pivot to the connection between chronic inflammation and cancer development. Dr. William Clark, can you start us off with how inflammation can escalate cancer risk?
Certainly. Chronic inflammation acts as a catalyst in the carcinogenesis process. It can lead to hormonal and metabolic changes that promote cancer cell proliferation. One key aspect is how it can create an environment conducive to DNA damage, which is a precursor to cancer.
I'd like to add to that. William makes an excellent point about the environment inflammation creates. From a surgical oncology perspective, managing post-surgical inflammation is critical. It's not just about immediate recovery. It's about influencing long-term outcomes, including cancer recurrence.
And there's an important interplay between genetics and inflammation we shouldn't overlook. Certain genetic predispositions can make individuals more susceptible to the adverse effects of chronic inflammation, leading to a heightened risk of developing cancer. Tasha is right. Moreover, I think it's crucial to discuss the role of infectious diseases in driving chronic inflammation. Diseases like HPV and hepatitis C don't just damage tissues directly, they initiate chronic inflammatory processes that can ultimately lead to cancer.
Discussing anti-inflammatory lifestyles seems pivotal at this juncture. Any thoughts?
Adopting an anti-inflammatory diet is foundational. Foods rich in omega-3 fatty acids, antioxidants, and phytonutrients can mitigate inflammation. However, it's not a universal panacea. Personalized dietary approaches based on an individual's health status, genetic predispositions, and existing conditions should be considered.
I have to interject with a neurological viewpoint. The brain's role in managing stress and how that contributes to systemic inflammation is often underestimated. Chronic stress aggravates inflammatory responses, creating a vicious cycle that may exacerbate cancer risk. Addressing stress is as crucial as dietary management.
While I appreciate the emphasis on diet and stress, we must also focus on the importance of early intervention and surgery to remove inflamed tissues when necessary. In some cases, this can prevent the transition from a precancerous state to full-blown cancer.
A balance is key. While surgical interventions are important, the identification and management of infections leading to chronic inflammation cannot be overlooked. Preventative measures, vaccines, and early treatment of infectious diseases are equally vital. There's an intersectionality here worth highlighting. Each of these measures, diet, stress management, surgical interventions, and infection control, are pieces of a larger puzzle. A multidisciplinary approach is crucial for effectively reducing cancer risk associated with chronic inflammation.
It's clear from this discussion that combating chronic inflammation involves a complex, multifaceted strategy. While we have our disagreements on the prioritization of interventions, the importance of a comprehensive approach is undeniable. Thank you for a vigorous and informative discussion panel. Welcome back. Today we're diving into the intricate relationship between environmental factors and cancer incidence. Mike, can you start us off with your perspective on how infectious diseases contribute to cancer?
Absolutely, Laura. It's well documented that certain infectious agents, such as the human papillomavirus or HPV, play a significant role in the development of cancers, notably cervical cancer. Environmental exposures that increase the risk of these infections can therefore indirectly contribute to cancer incidence.
While Mike's point on infectious diseases is valid, we cannot overlook the broader spectrum of environmental factors, such as pollution and chemical exposures, which have a profound impact on cancer rates. The connection between air pollution and lung cancer is particularly alarming.
William, I see what you're getting at. However, it's essential to differentiate between direct and indirect contributors. Infectious agents directly alter the cellular landscape, leading to cancer, whereas pollutants often act more indirectly.
On that note, Mike, the role of environmental factors cannot be minimized. For instance, asbestos exposure is a direct cause of mesothelioma. This points to the need for robust public health policies aimed at reducing exposure to known carcinogens.
Adding to Arthur's point, the debate shouldn't be about infectious versus non-infectious environmental factors. It's about recognizing the cumulative effect of multiple exposures and their interactions. A holistic approach is essential for prevention.
Ted, how do you weigh in on this, considering the neurological implications?
The discussion is fascinating because neurological cancers like gliomas have also been linked to environmental factors, albeit less directly. What's crucial here, and something I think we can all agree on, is the need for cross-disciplinary research to understand these complex interactions better.
Ted's call for cross-disciplinary research is spot on. Also, we can't overlook how socioeconomic factors determine one's exposure to these environmental risks, creating disparities in cancer incidence.
Exactly, Mike. The socioeconomic angle is crucial. Access to clean environments and healthcare plays a significant role in one's risk level. Addressing environmental cancer risks also means tackling socioeconomic disparities.
This discussion highlights the complexity of cancer causation, encompassing direct exposures like infectious diseases and asbestos, to broader issues like socioeconomic disparities. It's clear a multifaceted approach is needed in research and public health policy. Thank you for your insights. Let's move on to the next topic. Let's explore the critical relationship between dietary habits and cancer risk. Each of you brings unique expertise to this table. Dr. Washington, could you start us off with your dietary recommendation based on your oncological experience?
Certainly, Laura. The emphasis should be on a plant-based diet rich in fruits, vegetables, whole grains, and beans. Research consistently shows these foods are associated with a lower risk of certain types of cancer, especially gastrointestinal cancers.
I agree with Tasha's point on a plant-based diet's benefits, but want to highlight the role of obesity as a significant risk factor for cancer. Diets high in processed foods can lead to metabolic disorders, including cancer. So it's not just about what you eat, but also about maintaining a healthy body weight.
I'd like to add something about the role of infectious diseases in cancer. Certain dietary patterns can alter our microbiome, which in turn can impact our susceptibility to infections that might lead to cancer. So dietary habits indeed play a multifaceted role in cancer development.
That's a valid point, Mike. However, we cannot overlook the role of genetics. No diet can entirely eliminate the risk of cancer, especially if someone is genetically predisposed to it. A balanced diet can help, but it's not a panacea.
On Arthur's note about genetics, I must emphasize that while we can't change our genetics, lifestyle factors, including diet, do interact with our genetic predisposition. Epigenetics is a growing field, showing us how our choices can influence gene expression related to cancer risk.
This is fascinating. It shows the complexity of diet's role in cancer. Dr. Bates, from a neurological perspective, do you see any connections between diet, cognitive function, and cancer risk?
Absolutely, Laura. The brain is significantly affected by nutritional intake, and there is emerging evidence suggesting that diets high in antioxidants and anti-inflammatory components can not only support cognitive function, but may also lower the risk of brain cancers.
But let's not forget the practical aspect of implementing these dietary recommendations. Not everyone has access to fresh, wholesome foods due to socioeconomic factors. It's a challenge that needs addressing alongside these discussions.
William raises a crucial point about accessibility. Our recommendations must go hand in hand with public health initiatives to make healthy foods accessible and affordable to all demographics, to truly make a difference in cancer prevention. And while we push for plant-based diets, we must also be cautious about vilifying animal products completely. The key is moderation and ensuring that the consumption of these products is done in a way that's sustainable and healthful.
Indeed, this has been a rigorous exploration of the complex relationship between diet and cancer. Each of you has highlighted different aspects, from plant-based diets to the impact of socioeconomic factors, showing the multifaceted approach needed in addressing cancer prevention through diet. Let's continue to challenge and build on these ideas as we move forward. Let's explore how stress and lifestyle impact cancer prognosis. Ted, could you start us off with your insights on the neurological responses to stress?
Indeed. The relationship between stress and cancer progression is complex. Stress activates the hypothalamic pituitary adrenal axis, leading to increased cortisol levels, which can, in turn, affect tumor growth and spread. The evidence suggests that neural responses can, in fact, influence tumor microenvironments, promoting angiogenesis and metastasis.
While Ted's points are valid, I want to emphasize that it's not just the biological response to stress that plays a role. Patients with strong social support networks tend to exhibit better outcomes, indicating that psychological stress management could indirectly influence cancer prognosis.
Tasha, that's a crucial point. However, we must also look at how lifestyle factors linked to stress, such as sleep deprivation and poor diet, can compound these risks, creating a challenging situation for cancer patients. I have to interject with a slightly divergent view. While stress is indeed a factor, we mustn't overshadow the primary concerns in cancer progression, such as genetic predisposition and tumor biology. Yes, stress plays a role, but it's part of a broader picture that includes surgical and medical treatments.
I find myself aligned with Arthur's perspective, but with an additional note on hormonal imbalances. Stress-induced hormonal changes can certainly influence cancer risk and progression, specifically in hormonally sensitive cancers. The debate should therefore include how endocrine interventions might buffer these effects.
William, your point about hormonal imbalances is well taken, but let's not forget the direct mechanisms through which stress can act. Neuroimmunomodulation is a significant field of study that demonstrates how stress can influence the immune system's capacity to fight cancer.
And to build on Ted's argument, there's emerging research on how lifestyle interventions, such as mindfulness and exercise, might mitigate these stress responses, potentially improving outcomes in cancer patients.
While I agree with Tasha on the benefits of lifestyle interventions, we must be cautious not to oversell these methods. The primary focus should remain on proven medical treatments, though certainly supplemented by supportive measures.
This discussion underscores the multifaceted relationship between stress, lifestyle, and cancer. It seems clear that while medical treatments are paramount, integrating psychological and supportive care can play a critical role in cancer care.
Precisely, Laura. Surgical and medical interventions are at the forefront, but acknowledging the role of stress and lifestyle factors allows for a more comprehensive approach to patient care.
And if I may add, advancing our understanding of how neurological mechanisms interact with cancer will be key to developing new therapeutic strategies that address these very issues.
Thank you, everyone, for this spirited and informative discussion. It's evident that the interplay between stress, lifestyle, and cancer prognosis is intricate and requires a multidisciplinary approach to fully understand and address. We move forward to discussing a deeply concerning trend, the alarming rise in pediatric cancers. Dr. Washington, can you set the stage for us on this issue?
Certainly, Laura. We're witnessing an unprecedented increase in cancer diagnoses among children. One possible reason could be better diagnostic tools, but there's also evidence pointing toward environmental factors and possibly lifestyle changes. This trend underlines an urgent need for specialized research and tailored treatment protocols in pediatric oncology.
Agreed, Dr. Washington. But let's not overlook the strides we've made in surgical techniques for pediatric patients. The key here is early detection and employing minimally invasive strategies to not only treat but hopefully preserve quality of life for these young patients.
It's important to note, however, that while advancements in surgical techniques are invaluable, the etiology of these cancers often remains a black box. The role of viral infections in pediatric cancers, for instance, needs more spotlight. Studies have hinted at connections, but we're far from definitive answers. Mike makes an essential point. Understanding the why behind these cancers could radically change our approach to prevention. And prevention, as we all know, is the holy grail in cancer care.
Speaking of underlying causes, we can't ignore the neurological impact. Stress and environmental factors don't just impact adults. Children are equally susceptible. The consideration of how childhood stress may potentially contribute to cancer predisposition is an area ripe for further exploration.
Absolutely. And moving beyond causation, the metabolic and hormonal implications in treating pediatric cancer patients present a unique challenge. Children aren't just small adults. Their bodies react differently to treatment, and there's a critical need for developing protocols that acknowledge these differences.
I'm glad you brought that up, William. The one-size-fits-all approach fails miserably when it comes to pediatric patients. Targeted therapies, which consider the unique genetics of each child's cancer, are making headway but also present an ethical maze. How do we decide on who gets what treatment and when?
That's where the importance of interdisciplinary collaboration shines. Surgeons, geneticists, oncologists, we all must work hand in hand, constantly communicating and adjusting strategies. This holistic approach maximizes effectiveness and minimizes harm.
And let's not forget the role of infectious disease control in all of this. While our focus might be on treatment and surgery, preventing cancer-causing infections in the first place can significantly reduce the pediatric cancer burden.
An enlightening discussion. It's clear that while the challenges are significant, the dedication and innovation within this group and the larger medical community bring hope to this fight against pediatric cancers. Welcome back. Our next discussion focuses on the critical role of early screening in reducing cancer mortality. Let's jump right in. Tasha, could you share your insights on the latest breakthroughs in screening technologies?
Absolutely, Laura. Advances in liquid biopsy are groundbreaking. These tests have the potential to detect cancer early from a simple blood sample, catching tumors before they've even been imaged. However, the adoption rate in clinical practices is still slow due to the need for more validation. This technology could drastically reduce cancer mortality by catching it at its most treatable stages. While I see the promise in liquid biopsies, we must temper our enthusiasm with a dose of reality. The specificity and sensitivity of these tests vary widely among different types of cancer. For certain cancers, like pancreatic, they're a boon. For others, we're not there yet. It's a promising field, but one that requires rigorous clinical trials before widespread implementation.
Mike makes an excellent point on specificity and sensitivity. That's why, in the realm of surgical oncology, we emphasize the need for complementary diagnostic tools. Imaging advancements like PET scans and MRI have also improved, allowing us to pinpoint tumors with incredible accuracy, which directly impacts our surgical planning and outcomes.
It's crucial to remember the role of public health initiatives in promoting these screenings. The technology could be revolutionary, but without proper public health strategies to ensure widespread access and adoption, disparities in cancer care and outcomes will persist. Early detection must be a priority for all, not a privilege for the few who can afford or access these advancements.
William, you've hit a critical point about access and disparities. It reminds us that while we push for technological advancements, we must also strive to dismantle the systemic barriers that prevent equitable access to cancer screening and care.
Indeed, the technology and strategies for early screening have potential, but implementation is key. Speaking of which, Ted, your thoughts on how neurological advances might impact early screening?
The brain's role in cancer is indirect, but influential. Stress responses and hormonal changes can indeed influence tumor growth and patient outcomes. While not a screening method per se, Understanding the neurological implications can guide us in managing patients post-diagnosis and in remission, potentially impacting how we screen and treat patients with neuroendocrine tumors.
That's a fascinating intersection, Ted. The brain cancer nexus is an area ripe for exploration. However, we must prioritize direct screening methods and technologies that can detect cancer at its inception, regardless of the brain's mediating effects.
Absolutely. But let's not forget the importance of educating the public on screening's value. Technological marvels aside, if people aren't aware of or are hesitant to undergo screening, then its benefits are moot. Education and advocacy are as crucial as the technology itself.
And let's not underestimate the power of high-risk population identification. Genetics plays a colossal role in cancer risk. Genetic screening and counseling should work hand in hand with our advanced screening technologies, tailoring our approach to those most in need.
This conversation underscores the multiplicity of factors at play in the realm of early cancer screening, from technological breakthroughs to public health policy and patient education. Our collective effort in research, policy, and practice can indeed lead to a decrease in cancer mortality. Thank you all for such an insightful discussion. Thank you for joining us. Today we're delving into the role of artificial intelligence in cancer diagnosis and treatment. Dr. Michael Tang, can you start us off with how AI is currently utilized in oncology?
Certainly, Laura. AI is revolutionizing oncology, from early detection to personalized treatment plans. For example, machine learning algorithms can now analyze medical images with precision that matches or exceeds human capabilities, identifying tumors that are too subtle for the naked eye. I have to jump in and acknowledge Mike's point there. The precision is remarkable indeed. However, I want to stress the importance of not viewing AI as a replacement, but as a supplement to human expertise. The nuanced understanding a trained oncologist brings to a patient's case is irreplaceable.
Exactly, Tasha. While AI's ability to crunch data is unparalleled, it lacks the empathic judgment a surgeon or oncologist applies to each case. I've seen instances where AI recommendations were clinically sound, but didn't align with the best surgical approach, considering the patient's overall health and recovery prospects.
And let's not overlook the potential for neurological applications. AI can help predict patient responses to treatments based on genetic information and brain behavior. But Arthur's point stands. These technologies should enhance, not substitute, the clinician's role.
The endocrinological perspective is fascinating here. AI aids in understanding how hormones interact with various treatments, but the algorithm's efficiency should not lead us into a false sense of security. No AI can yet grasp the full complexity of human biology as a seasoned physician does.
I hear the concerns, but let's not downplay AI's potential to democratize cancer care. It can provide high-level diagnostic support in underserved areas, bridging a significant gap in the access to expertise. It's about the right tool in the right hands.
Those are compelling points, and it showcases the balance between technological advancement and human touch. Dr. Tang's mention of democratizing care is particularly striking. Would anyone argue that AI might inadvertently widen the healthcare divide, though?
Well, Laura, that's a concern. While AI can indeed bridge gaps, its implementation requires substantial investment. There's a risk that only well-funded healthcare systems benefit, widening the disparity in global cancer care.
A valid point, Tasha. However, as the technology becomes more widespread and cost-effective, I believe its benefits will permeate through various levels of healthcare, ideally narrowing that divide over time.
The ethical implications cannot be ignored either. As we introduce AI into more aspects of care, maintaining transparency about its use and ensuring patient consent is paramount. Patients must understand when AI is part of their care decisions.
Absolutely, Ted. The ethical dimension extends to data privacy. Utilizing vast datasets for AI development poses a significant responsibility in safeguarding patient information.
It does, William. But let's also appreciate the enormous potential AI has for predictive analytics in oncology, significantly advancing our approach to prevention and early intervention.
Exactly. The consensus seems to be that AI represents both a monumental opportunity and a challenge, requiring careful ethical consideration, clear guidelines, and a balanced approach to integration with human-led care. As we continue to explore this frontier, the expertise of oncologists, surgeons, neurologists, endocrinologists, and all healthcare providers will be essential in guiding the responsible application of AI in cancer care. Thank you all for your insightful and passionate contributions. Today, we dive into the fascinating realm of personalized cancer therapy. Dr. Tasha Washington, can you kick us off with your insights on targeted treatments?
Absolutely, Laura. The beauty of personalized cancer therapy lies in its precision. By targeting specific genetic mutations within a cancer cell, we can develop treatments that are vastly more effective and have fewer side effects than traditional chemotherapy. It's not only a step forward, it's a leap. While I agree with Dr. Washington's enthusiasm, I think it's crucial to consider the limitations. Misidentification of targets and the potential for rapid mutation of cancer cells can lead to resistance against these targeted therapies. It's a promising field, but not without its hurdles. That's a valid point, Dr. Tang. However, with the advent of CRISPR and other gene editing technologies, we're becoming better at swiftly identifying and adapting to mutations. The potential for personalized medicine to revolutionize cancer treatment is undeniable.
I want to echo Dr. Washington's optimism, but also stress the surgical perspective. While targeted therapies are advancing, they cannot always replace the need for surgical intervention. In many cases, they might complement each other, enhancing overall treatment effectiveness.
It's important to consider the endocrinological side as well. Hormone-sensitive cancers, like breast and prostate cancer, have seen significant advancements with targeted therapies. These treatments offer a more nuanced approach to manipulating hormone levels and blocking cancer cell growth.
From a neurological standpoint, the precision of these therapies could mean fewer neurotoxic side effects, a common issue in traditional treatments. This could greatly improve the quality of life for patients undergoing treatment for cancers affecting the nervous system.
Precisely, and as we delve deeper into the molecular makeup of tumors, we're discovering more actionable targets. It's an evolving field where today's challenges are tomorrow's victories. Yet we mustn't overlook the ethical concerns. The cost and accessibility of these personalized treatments are significant barriers. If only a select few can afford these advances, are we really making progress? Dr. Tang raises an uncomfortable truth. We need to work alongside policymakers to ensure that these life-saving treatments are accessible to all, not just the privileged few.
And let's not forget about the implications for surgical practices. As targeted treatments evolve, so too must our surgical techniques and strategies. It's a multidisciplinary effort that requires constant adaptation.
Agreed. The interplay between targeted therapy and hormonal manipulation opens new avenues for treating endocrine-related cancers, reinforcing the need for a cohesive approach across specialties.
It's clear that personalized cancer therapy holds great promise, accompanied by significant challenges. The collaboration across disciplines and the translation of these advanced treatments into accessible care will be vital. Our discussion today underscores the complexity and the hope within this field. Thank you, panelists, for a thought-provoking discussion. Let's move on to a complex yet pivotal area of cancer treatment, the role of stem cell therapy. Dr. William Clark, given your background in hormonal and metabolic disorders, could you give us an overview of the current state of stem cell research in oncology?
Certainly, Laura. Stem cell therapy has shown a lot of promise in regenerating damaged tissues and organs. Specifically, in oncology, hematopoietic stem cell transplantation is a well-established treatment for certain types of blood cancers. However, the application of stem cells in solid tumors is still under rigorous investigation. The potential is there, but so are the risks, including the possibility of promoting tumor growth.
I appreciate William's caution. I want to add that the targeted nature of stem cell therapy could revolutionize our approach to cancer treatment. We've seen remarkable successes in blood cancers, as William mentioned. These successes fuel our optimism for extending these therapies into more common solid tumors. Yet the biggest hurdle remains distinguishing between cancer cells and the normal cells we aim to target. Speaking of risks, Tasha, let me jump in here. The risk of eliciting an unintended response is non-trivial. For instance, introduced stem cells could potentially migrate to non-target areas, or worse, contribute to a new neoplastic process. The science is promising, but navigating these safety concerns is paramount.
And to add to Mike's point, from a surgical perspective, the application must be incredibly precise. We've made significant advancements in delivering treatments directly to tumor sites, but stem cells, due to their nature, present a challenge. They're not as easily controllable once inside the body.
That's a fascinating intersection of potential and precaution. Dr. Tasha Washington, how do you see ethical considerations playing into this, especially with such high-risk, high-reward treatments?
Ethics are at the core of this discussion, Laura. The promise stem cell therapy holds for cancer patients is undeniable, yet proceeding with caution is ethical, particularly in clinical trials. Transparency with patients about potential risks and benefits is crucial. As we tread new ground, ensuring informed consent and prioritizing patient safety is ethical and necessary.
Ethical indeed, Tasha. But let's not overlook the psychological aspect of introducing a new, yet partially understood, treatment to patients. The hope can be immense, but so can be the disappointment. It's our responsibility to balance optimism with reality in patient discussions.
Well, Ted makes a valid point on the psychological implications, but let's not allow fear of the unknown to stifle innovation. Rigorous clinical trials and ethical oversight are our best tools for safely navigating these uncharted waters.
Exactly, William. Innovation balanced with caution and oversight. It's how we've made progress in all fields of medicine, including cancer. Stem cell therapy's potential benefits can't be ignored because of its risks. Rather, both must be weighed seriously.
A stimulating exchange of ideas indeed. It's clear that stem cell therapy in cancer treatment is a field ripe with both promise and challenges. The diversity of opinions here highlights the complexity of advancing such treatments responsibly. Thank you for your insights. Let's proceed to the next segment. Welcome back. Our discussion now turns towards the fascinating and somewhat contentious world of gene editing techniques in cancer treatment. Dr. Michael Tang, can you kick us off by discussing the potential of these technologies?
Certainly, Laura. The promise of CRISPR and other gene editing technologies in oncology is revolutionary. We're talking about precision tools capable of correcting genetic mutations at their source. However, the application in cancer therapy isn't without substantial challenges and ethical dilemmas. I must emphasize Mike's point on ethical dilemmas. The idea of editing our genes can lead to significant concerns, especially about off-target effects. These technologies are powerful, but the question remains, how do we ensure they're used safely and benefit those in dire need?
That's a valid concern, Tasha. However, focusing on the potential benefits for a moment, gene editing offers a ray of hope for patients with cancers that were once considered untreatable. If we navigate the ethical waters carefully, we stand on the brink of a new era in cancer therapy.
Speaking of navigation, it's pivotal that any advancement in gene editing comes with strict regulatory oversight. Without it, we risk misuse and a potential public backlash that could set back research decades.
Arthur's right. But let's not underestimate the scientific community's ability to self-regulate and innovate with caution. The progress in gene editing technology has been rapid, yet responsibly conducted. Of course, regulatory frameworks must evolve in tandem to address the unique challenges these treatments present.
To add to Mike's optimism, consider the neurological cancers. Here, precise gene editing could theoretically target malformations or genetic predispositions with unprecedented precision. Yet we must balance our enthusiasm with ethical considerations, especially concerning hereditary changes.
Indeed, Ted. And turning back to patient safety, it's critical to mention that while gene editing holds immense promise, it still poses significant risks. Off-target effects could have unforeseen consequences, so while we pursue these treatments, patient safety must remain paramount.
It's clear that gene editing in cancer treatment carries both promise and uncertainty. As we forge ahead, It's crucial that this balance between innovation and ethics stays at the forefront of our endeavors. Does anyone have final thoughts?
Just a quick addition. Let's not forget the importance of public engagement and education on this journey. Transparency about the benefits and the risks involved is crucial.
Absolutely, Mike. Engaging with the public will help demystify the science and hopefully garner support for responsible research.
Thank you, panelists, for a thought-provoking discussion. The potential of gene editing techniques in cancer treatment is immense, but so is the responsibility that comes with it. Let's continue to approach this frontier with both optimism and caution. Welcome back. Our next discussion focuses on the effectiveness of chemotherapy versus immunotherapy, a critical consideration in patient treatment plans. Dr. Washington, could you begin by highlighting the latest advances in immunotherapy?
Certainly, Laura. Immunotherapy has shown remarkable progress, particularly with treatments like checkpoint inhibitors, which have been game changers for certain cancers, such as melanoma. These therapies work by unleashing the body's own immune system to attack cancer cells, and the results have been groundbreaking for patients who respond. But it's crucial to highlight that not all patients respond to immunotherapy. That's where the limitation lies. For a subset of patients, chemotherapy remains a more effective option. It's a complex decision-making process that requires a nuanced understanding of the patient's specific cancer type and genetic makeup.
On that note, it's important to consider the side effects. Chemotherapy, as we know, doesn't discriminate between cancerous and healthy cells, which leads to a range of side effects. Immunotherapy, while more targeted, can induce an overactive immune response, leading to autoimmune-like symptoms.
Right, Arthur. And that's where personalized medicine comes into play. Identifying genetic markers and tailoring treatments, whether chemotherapy, immunotherapy, or a combination, can significantly improve outcomes. Yet I must emphasize, not all tumors have identifiable markers amenable to targeted therapies.
That brings up an important point about the disparity in access to these treatments. Immunotherapies, despite their potential, are often more expensive than traditional chemotherapies. This cost factor can limit access for many patients, underscoring the need for equitable cancer care solutions.
A pivotal aspect often overlooked is the effect of these treatments on the patient's quality of life. Immunotherapy, with its potentially fewer side effects, might offer a better quality of life for some patients, but the unpredictability of its efficacy is a significant concern.
Dr. Tang, how do you see the role of innovations in improving the efficacy of immunotherapy?
There's promising research into combining immunotherapies with other treatments, like targeted therapies or vaccines, to enhance the immune system's ability to fight cancer. While it's an evolving field, the potential for synergistic effects could make immunotherapy viable for a broader patient population.
However, we shouldn't disregard the foundational role chemotherapy has played in oncology. It remains a cornerstone of treatment for many cancers, particularly in complex, advanced stages, where immunotherapy options are limited or not yet fully understood.
Absolutely, but the trajectory of cancer treatment is leaning towards more personalized approaches. The challenge lies in accelerating the pace of research to discover biomarkers and tailor immunotherapies for a wider array of cancers. The evolution is ongoing, but the direction is clear.
It's a matter of balancing optimism with realism. As much as we herald the advances of immunotherapy, we also have to address its limitations and work towards making it accessible and effective for all patients.
An engaging discussion. It's clear that while immunotherapy presents a promising avenue in cancer treatment, achieving the best patient outcomes often requires a combination of therapies informed by both advances in science and considerations of the patient's overall well-being. The integration of multiple perspectives, as we've seen here, is vital in navigating these complex treatment landscapes. Thank you all for your insights. Let's delve into the developments in radiotherapy techniques and their efficacy in cancer treatment. Arthur, Could you start us off by sharing the latest in surgical intervention and how it complements radiotherapy?
Of course, Laura. The evolution of surgical techniques, especially minimally invasive and robotic-assisted surgery, has significantly improved patient outcomes. These advancements allow for more precise tumor removal with less damage to surrounding tissues. When combined with the latest radiotherapy techniques, such as intensity-modulated radiation therapy, IMRT, and stereotactic body radiotherapy, SBRT, we can target tumors more effectively while minimizing side effects.
That's a valid point, Arthur. The precision of current radiotherapy techniques indeed complements surgical interventions well. However, I think it's crucial to highlight the emerging role of proton beam therapy. Its precision, specifically in pediatric cancers, means less collateral damage to healthy tissues, which is vital for reducing long-term side effects.
I'd like to add to Tasha's point about proton beam therapy. Its efficacy goes beyond pediatric cancers. Studies have shown promising results in treating brain tumors, head and neck cancers, and prostate cancer. This specificity can significantly lower the risks of secondary cancers, which is a concern with traditional radiotherapy.
While I acknowledge the sophistication of proton beam therapy, we must also consider the cost and accessibility issues it presents. It's crucial that we balance innovation with the practicality of widespread implementation. Not all patients have access to such specialized treatment options.
William raises an important concern. However, the long-term benefits and potential cost savings in terms of reduced side effects and secondary treatments could justify the initial investment in technologies like proton beam therapy. It's about looking at the bigger picture.
Diving deeper into the precision of these radiotherapy techniques, let's not overlook their neurological implications. For example, SBRT offers a compelling treatment option for brain metastases, significantly improving control in the brain while preserving cognitive function, thanks to its accuracy.
It's clear that the precision and reduced side effects of these advanced radiotherapy techniques offer great benefits, but as William mentioned, access remains a challenge. How do we see this evolving in the future? Can these technologies become more accessible to patients worldwide?
It's a matter of investment in healthcare infrastructure and training. As these technologies prove their value, we should see a push towards wider adoption. It's also a question of policy and ensuring that healthcare systems prioritize advancements that offer long-term benefits to patients and cost savings.
And with the rapid advancements in AI, we might see further improvements in radiotherapy planning and delivery, making it even more effective and possibly more accessible as computational resources become cheaper and more widely available.
Absolutely, Mike. The integration of AI can not only optimize treatment planning, but also predict treatment outcomes, enhancing personalized medicine in oncology.
This discussion underscores the importance of continued innovation and collaboration across disciplines to improve cancer treatment. The advancements in radiotherapy techniques represent a significant leap forward in our ability to treat cancer more effectively and with fewer side effects. However, the issue of accessibility highlights the need for global efforts to ensure that all patients can benefit from these advancements. Thank you all for your insightful contributions. Let's pivot to a topic gaining ground in the fight against cancer: vaccines. The promise they hold is undeniable, but let's unpack their impact and future potential. Dr. Tang, could you start by outlining the developments in vaccines for virus-related cancers?
Certainly, Laura. We've seen groundbreaking success with vaccines against HPV, for instance, which significantly reduces the risk of cervical cancer. It's a clear demonstration of how effective vaccines can be in preventing certain types of cancer. The science here is solid, and the results are tangible.
I have to jump in and agree with Mike on the impact of HPV vaccines. However, it's critical to understand that not all cancers are caused by viruses, which means vaccines can't be our only line of defense. Our focus should also be on precision medicine and targeted therapies for non-virus-related cancers.
While vaccines like the one for HPV are a leap forward, the surgical landscape for cancer treatment is still very much essential. Minimally invasive techniques and robotic surgeries have transformed patient recovery times. It's about integrating vaccines into a broader, multidisciplinary approach.
Exactly, Arthur. And I want to point out the hormonal aspect. Certain cancers, especially those like prostate and breast cancer, have hormonal drivers that vaccines don't address. It's imperative we continue exploring treatments that target these specific mechanisms.
I see your points, but let's not underestimate the potential for vaccines to be developed for non-viral cancers. With advancements in immunotherapy and our growing understanding of tumor antigens, we're on the cusp of being able to train the body's immune system to fight cancer more effectively.
Mike, while I share your optimism, we must balance it with caution. The development of therapeutic cancer vaccines is complex and must consider the tumor microenvironment's evasive tactics. The truth is, we have seen many failures in this area due to the heterogeneous nature of tumors.
And don't forget the neuropsychological angle. The stress and anxiety around cancer can significantly affect the immune system. While a vaccine may prevent or treat the physical manifestation of cancer, we also need strategies to support mental health and resilience in patients.
This is a rich discussion. The interplay of prevention, direct treatment, and supportive care in cancer is multifaceted. Vaccines have their place, especially in prevention, but as you've all touched upon, our approach must be holistic and adaptable.
Laura, if I may add, the future of vaccines in treating or even preventing other types of cancer lies in the continued advancement of genetic profiling and immunotherapy. We should be investing in research that explores these frontiers.
Arthur makes a pivotal point. The marriage of genetic insights with immunotherapy paves the way for personalized vaccines. Though, the ethical and financial implications of these developments cannot be overlooked. We're looking at a future where cancer treatment could become exceedingly personalized, but also potentially more costly.
And yet, the cost of not pursuing these avenues, both in human life and economic impact, is far greater. The challenge lies in ensuring equitable access to these groundbreaking treatments. This conversation underscores the need for more research, collaboration, and critically funding.
Absolutely, Mike. The trajectory for cancer vaccines is promising but laden with challenges. Our task as researchers and clinicians is to continue pushing the boundaries of what is possible in cancer treatment and prevention, always with our patients' best interests at heart.
A fitting note to end on. Thank you all for a spirited and illuminating discussion. The pathway to defeating cancer is indeed complex and requires dedication, innovation, and collaboration across disciplines. Let's delve into the complex interplay between cancer and mental health, a crucial aspect of comprehensive cancer care. Ted, could you start us off by exploring the psychological impact of a cancer diagnosis?
Certainly, Laura. The psychological tsunami that hits patients post-diagnosis cannot be overstated. Anxiety, depression, and a sense of isolation become as significant as the physical battle against cancer. It's a duel on two fronts, the body and the mind. The neurological responses to stress can indeed exacerbate the physical condition, making a strong case for integrated psychological support.
I have to jump in here, Ted. You're spot on about the need for integrated care. I've seen firsthand in my oncology practice how patients with robust mental health support not only navigate the treatment better, but also often have improved outcomes. It's not just about survival rates, it's about the quality of life during and after treatment.
I won't argue with the importance of mental health in cancer care. However, we must not overlook the biochemical side of things. Hormonal imbalances, metabolic changes, these can both influence and be influenced by a patient's psychological state. It's a bidirectional relationship. We need a holistic approach that addresses both psychosocial and physiological aspects.
Point taken, William. But let's not forget about the substantial barriers to implementing such comprehensive care. The resources, the trained personnel, it's not universally available. And in surgical oncology, the focus often narrows down to physical removal of tumors, sidelining mental health considerations.
Arthur raises a crucial concern regarding resources. In the realm of infectious diseases, we often see the physical manifestations prioritized over mental health. However, I must emphasize, as Ted and Tasha mentioned, the undeniable connection between mental health and immune function. Stress management isn't just about feeling better, it's about actively bolstering the body's defense mechanisms against cancer progression.
Absolutely, Mike. And to add, the stigma surrounding mental health issues in patients with cancer must be addressed. Patients often hesitate to seek help due to fear of being perceived as weak. This stigma is a significant barrier to care.
Speaking of barriers, Tasha, let's not glance over the different psychological impacts and care needs across diverse populations. Cultural competencies in mental health care are not just an ethical necessity, but a practical one to ensure all patients receive empathetic and effective support.
A heated but essential discussion. It's clear the integration of mental health into cancer care isn't just beneficial, it's imperative for holistic patient care. The obstacles are significant, but the consensus points towards a need for a unified front in addressing both mental and physical health. Let's now shift our focus to the potential of medical cannabis in pain management for cancer patients. Dr. Bates, could you introduce us to the current landscape regarding this topic?
Certainly, Laura. Research has increasingly shown that cannabinoids have significant analgesic properties. This is crucial for cancer patients, who often endure severe pain that conventional medications fail to adequately manage. However, it's important we consider the breadth of data and remain critical of both its limitations and potential.
I'd like to add to Ted's point. The interest in cannabinoids has been heightened not just by their pain management potential, but also due to their lower dependency risk compared to traditional opioids. However, we must rigorously ensure that we're not replacing one set of problems with another.
That's a valid concern, William. But we also have to consider patient testimonials. Many have reported significant improvements in quality of life due to medical cannabis. While anecdotal evidence should not replace clinical trials, it does indicate areas where further research could be beneficial.
I agree with Tasha on the importance of patient experiences, but let's also delve into the complications surrounding the legal and ethical aspects of prescribing cannabis. Despite its medicinal properties, the classification of cannabis at the federal level complicates its accessibility, research, and acceptance in the medical community.
Mike brings a good point to the table. The legal hurdles are not trivial. However, we can't allow bureaucratic inertia to impede the exploration of potentially effective treatments. The therapeutic benefits of cannabis, including antiemetic and appetite stimulation properties, especially in a palliative care setting, are too significant to ignore.
And not to forget, the side effect profile of medical cannabis, while not inconsequential, is often more favorable compared to that of many conventional pain management therapies. This is an area where patient preferences should weigh heavily in the decision-making process.
Ted, while patient preference is important, we must tread carefully. The lack of standardized dosing guidelines and the variability in cannabis strains pose challenges in prescribing practices. The medical community's goal should always be to do no harm, and the uncertainty surrounding cannabis necessitates cautious optimism.
William's caution is warranted, but let's not overshadow the potential here. The conversation about medical cannabis in cancer care is evolving. As researchers, it's our duty to push the boundaries of what we know, guided by a balanced understanding of both benefits and risks. Rigorous, well-designed studies are required to move the needle forward in this debate.
I appreciate the robust discussion, panel. It's clear that while medical cannabis may offer a promising adjunctive treatment for pain management in cancer patients, the path forward involves addressing regulatory challenges, bolstering research efforts, and developing comprehensive clinical guidelines. Thank you, everyone, for your insightful contributions. Let's dive into a crucial issue: access and affordability of cancer care. Many argue that disparities in cancer care are one of the biggest challenges we face today. Dr. Tasha Washington, can we start with your perspective on this matter?
Absolutely, Laura. The disparities in cancer care, especially across socioeconomic groups, are stark and troubling. Research consistently shows that marginalized communities have lower access to cancer screening, treatments, and palliative care. This isn't just an issue of national policy, but a fundamental question of social justice.
I agree with Dr. Washington. The endocrinology of cancer shows us how deeply intertwined health outcomes are with socioeconomic status. Stress, diet, and exposure to environmental toxins, all of which disproportionately affect lower-income populations, can significantly increase cancer risk.
I appreciate your points, but I also think we must not overlook the role of individual responsibility in health outcomes. While disparities are real and significant, there's also a need to empower individuals with information and access to preventive measures.
That's a valid point, Arthur. However, even when informed, many individuals simply cannot access preventive measures due to cost or availability. It's about equality of opportunity as much as it is about personal responsibility.
And let's not forget, the disparities in outcomes extend beyond prevention and access. In my field, infectious diseases linked to cancer, like HPV, highlight significant gaps in vaccination rates among different socioeconomic groups, which is a precursor to higher cancer rates in these communities.
What can be done to address these disparities at a systemic level?
Public health initiatives play a colossal role. Educational programs aimed at higher-risk communities can raise awareness of prevention and early detection. Furthermore, we must advocate for policy changes that make healthcare, including preventive services like vaccinations and screenings, universally accessible and affordable.
It's also about insurance and government policies. Expanding coverage and reducing out-of-pocket expenses for screenings and treatments can make a substantial difference. Financial barriers should never prevent anyone from accessing life-saving cancer care.
Indeed, and the innovation in treatment methods must be matched by innovative healthcare models and funding mechanisms. Philanthropy and public-private partnerships could be pivotal in bridging the gap.
Absolutely. But let's also look at the global picture. The model we develop and implement here can serve as a blueprint for cancer care in low and middle income countries, where the disparities are even more pronounced.
This conversation underscores the complexity of the issue. It's clear that while individual responsibility and empowerment are essential, there is a critical need for systemic change, ranging from policy adjustments, insurance reforms, to comprehensive public health initiatives aimed at addressing these disparities head-on.
Yes, Laura. And let's not underestimate the power of technology in this equation. Telemedicine, mobile health units, and other innovative solutions can play a significant role in democratizing access to cancer care, making it more equitable across all socioeconomic groups.
Those are all excellent points. As we've discussed, addressing the disparities in cancer care requires a multifaceted approach, emphasizing both systemic reforms and individual empowerment. Thank you all for such an insightful discussion. Let's continue to advocate for changes that ensure everyone has equal access to the care they need. Let's pivot to discussing the impacts of new regulatory policies on cancer treatment. Dr. Clark, can you start us off with your perspective on recent changes?
Certainly. The introduction of stricter regulatory policies for drug approval has been a double-edged sword. On one hand, it ensures that only thoroughly tested drugs make it to the market, protecting patients from potential harm. However, it can also slow down the availability of groundbreaking treatments.
I concur with William to an extent. The rigorous review process is indeed vital for patient safety. Yet I believe the emphasis should also be on streamlining the process to reduce time to market for promising treatments. I've personally seen the frustration in patients waiting for new therapies.
Adding to Tasha's point, what's troubling is when bureaucracy overshadows scientific evidence. I've seen situations where regulatory hurdles have delayed surgeries or the adoption of new surgical technologies, affecting patient outcomes.
That's a valid observation, Arthur. But isn't it also true that these policies are put in place to prevent premature adoption of unproven methods? In infectious disease, for instance, we've seen how rushed interventions can backfire.
Mike raises a crucial point. The implementation of strict regulatory policies is fundamentally about safeguarding public health. Remember, while we're eager to advance, patient safety must be our priority. The key is finding a balance.
Balance is right, but let's not forget about access. Regulatory policies can disproportionately affect access to treatment across different populations. We need policies that ensure innovations are not only developed quickly and safely, but are also accessible to all patients, regardless of socioeconomic status.
Exactly, William. The conversation about regulation isn't just about safety and efficiency. It's deeply intertwined with issues of equity and justice in healthcare. Innovations that can't reach all segments of the population only widen the existent health disparities.
It's clear there's a pressing need for regulatory frameworks that are both robust and agile. This would ensure safety while also facilitating access to groundbreaking treatments. Thank you, panelists, for such a spirited discussion. It's crucial for us to continue challenging and evolving these frameworks for the betterment of patient care worldwide. Let's delve into one of the most sensitive areas of cancer care, the ethical considerations in terminal cancer care. Dr. Clark, could you start us off by discussing the role of palliative care?
Certainly, Laura. Palliative care focuses on providing relief from the symptoms and stress of a serious illness. It's about improving the quality of life for both the patient and the family. However, there's a nuanced debate about when to transition from active treatment to palliative care.
And that transition can be contentious. The ethical dilemma arises in determining the patient's best interest. We're tasked with balancing hope and realism without prematurely ceasing efforts that could potentially extend life.
I must interject, Dr. Washington. While I agree with your point on the balance, I vehemently believe in the importance of clear communication regarding the limitations of treatment. Ethically, we're obligated to ensure that patients understand their prognosis, even when it's grim.
Adding to that, the consideration of quality versus quantity of life is paramount. In some cases, aggressive treatments may extend life slightly, but at the cost of severe side effects, thus diminishing the quality of the remaining life. The patient's wishes should guide these decisions.
It's important to note the psychological toll on not just patients, but also on families making these decisions. Ethical considerations should include support mechanisms for families grappling with these heartbreaking choices.
Indeed, Dr. Bates. Yet let's not overlook the decision-making capacity of our patients. Autonomy is a cornerstone of medical ethics. This can get complex when patients are too ill to make decisions for themselves.
That's a critical point, but let's not forget about the socioeconomic factors. Ethical considerations must account for disparities in access to both curative and palliative care. It's unjust to have a patient's financial situation dictate the quality of their end-of-life care.
Dr. Washington raises an essential issue. Disparities in care are a profound ethical concern that we cannot ignore. Dr. Hastings, how do we see this affecting decisions on surgical interventions?
It's complex, Laura. In an ideal world, surgical decisions would be made purely on clinical need and patient preference. However, the reality is often far from this. Access to high-quality surgical options can be limited by factors beyond the patient's control, an issue that speaks to a greater ethical failure in our system.
Another layer here is the advent of new technologies and treatments which can offer hope but also complicate ethical decisions. How do we decide who gets access to experimental therapies, especially when resources are limited?
And how do we navigate the hope that such options present against the reality of their experimental nature? Transparency and informed consent become even more critical in these scenarios.
A fascinating discussion. It's clear that ethical considerations in terminal cancer care are multi-layered and deeply complex, involving not just medical but also societal and personal factors. Thank you, panel, for such insightful contributions. Welcome back. We now turn our focus to the ongoing search for a cure for metastatic cancers. Dr. Washington, can you start us off with your perspective on the current state of research in this area?
Certainly, Laura. we've seen significant strides in understanding the molecular mechanisms that drive metastasis. Targeted therapies and immunotherapies are showing promise in clinical trials. However, the complexity of metastatic cancer means one-size-fits-all solutions remain elusive.
I must emphasize Tasha's point on complexity. Surgical interventions have evolved, but the challenge lies in detecting and accessing metastatic tumors. It's an ongoing battle between advancing surgical techniques and the cunning nature of metastasis.
Speaking of advancements, the role of infectious disease research in understanding tumor microenvironments cannot be overlooked. Certain viral vectors are being explored as potential tools in targeting metastatic cells.
While those points are valid, we must not overlook the metabolic aspect. Our understanding of how metabolic reprogramming aids cancer survival and metastasis opens new doors for treatment, specifically in restricting cancer cells' energy supply.
Neurology plays a role here too. Brain metastases, for example, are notoriously difficult to treat. Research into the blood-brain barrier and how cancer cells traverse it can lead to breakthroughs in therapeutic delivery systems.
Absolutely, Ted. But it's crucial to implement a multidisciplinary approach. Breakthroughs in one specialty need to be shared across the board to truly innovate in treating metastatic cancers.
Tasha, that's a good point. The integration of surgical methods with these innovations could drastically change outcomes. But we must acknowledge that our current pace might not be fast enough for patients currently battling metastatic diseases.
I disagree, Arthur. The pace of research is unprecedented. Yes, more can always be done, but look at gene therapy and CRISPR technology. We are on the cusp of something revolutionary.
Mike, the technology is promising, but the ethical considerations and potential for unintended consequences cannot be ignored. The application of gene editing in metastatic cancer demands rigorous oversight.
And let's not forget the potential neurological impacts. The implications of these treatments on the nervous system are still largely uncharted territory.
I think that's why it's vital to maintain patient-centric research. Beyond just extending life, our focus should be on the quality of life. Pain management, neurological function, metabolic health, all are critical factors.
Indeed, ensuring that the patient remains at the heart of our research is crucial. As we look to the future, what are some realistic timelines for the public to expect breakthroughs?
Realistically, it's a matter of years, not months. Each breakthrough undergoes rigorous testing phases. However, the acceleration in collaborative research and technology gives us hope for faster developments than previously seen.
Joining forces across disciplines, as we've discussed here, might just be the key to unlocking those breakthroughs sooner.
With the caution that we proceed ethically and consider the long-term implications of our innovations. Patient safety and well-being must guide our endeavors.
Absolutely. The interdisciplinary exchange of ideas and findings will catalyze our progress towards understanding and eventually curing metastatic cancers.
Thank you, panelists, for this enlightening discussion. It's clear that the search for a cure is multifaceted, requiring contributions from every corner of the medical and scientific communities. With continued collaboration and research, we hold on to the hope for a future where metastatic cancer is no longer a death sentence. As we draw this roundtable to a close, I'd like to invite final thoughts from each of our esteemed panelists on the future of cancer research and patient care. Dr. Washington, would you start us off, please?
Certainly. The evolution of cancer treatment towards precision medicine represents a monumental shift in our approach. However, we must address the disparities in access to these innovations. Every breakthrough in targeted therapy or immunotherapy must be matched with efforts to ensure all patients can benefit, regardless of socioeconomic status.
I agree with Dr. Washington on the importance of accessibility. However, I'd emphasize even further the role of technology in surgical oncology. Robotic surgery is not just a tool. It's transforming how we think about and execute cancer surgery, making it less invasive with faster recovery times. But the cost and the learning curve remain significant challenges.
The discussion on technology brings us to the undeniable impact of infectious diseases on cancer incidence. As we advance, our understanding of viral genetics opens new doors for both prevention and treatment. It's crucial, though, that our enthusiasm for high-tech solutions doesn't divert attention from basic public health measures that can prevent infection-related cancers in the first place.
That's a valid point, Mike. And let's not overlook the neurological aspect. Stress and mental health have a profound impact on cancer outcomes. Research is increasingly showing that psychological support services must be an integral part of cancer care, not an afterthought. This holistic approach is crucial for the future of oncology.
Absolutely. And I'd like to highlight the hormonal and metabolic dimensions. The intricate dance between cancer and conditions like diabetes demonstrates the need for a multidisciplinary approach to patient care. We must bridge the gap between specialties to offer comprehensive care that addresses not just the tumor, but the whole patient.
It's evident from our discussion that the future of cancer care and research is both promising and challenging. Advances in genetics, surgery, and treatment strategies like immunotherapy and targeted therapy hold great promise. However, we face substantial obstacles in terms of accessibility, multidisciplinary care, and integrating mental health support.
Laura, if I may add, the promise of precision medicine is only as good as our commitment to equity. Ensuring that these advances benefit everyone, not just a privileged few, is perhaps one of the greatest challenges we face.
And while technology in surgery is advancing rapidly, the real innovation will come from making these techniques widely available. It's not just about the tools, but also about training surgeons worldwide to use them effectively.
Indeed, and let's not forget, preventing cancer is as crucial as treating it. Investments in public health to combat infectious diseases that lead to cancer must continue to be a priority.
Adding to that, our approach must be holistic, considering the mind's impact on the body. The psychological aspect of cancer care is critical for improving quality of life and potentially even survival rates.
Finally, interdisciplinary collaboration is the foundation upon which the future of personalized care must be built. It's through combining our knowledge and resources that we can tackle the complexities of cancer more effectively.
Thank you, everyone, for your contributions today. This conversation has underscored the multifaceted nature of cancer and the diverse approaches required to combat it. As we move forward, it's clear that collaboration, innovation, and equity are key to achieving the best outcomes for patients everywhere. Thank you to our panelists for their insights and to our viewers for their attention. Stay informed and continue advocating for advancements in cancer care and research.